We continue now our series, Issues That Matter, with a closer look at the Republican health care bill and the questions about cost and coverage. In a letter to Congress, the American Hospital Association said it is concerned about the plan's effort to restructure the Medicaid program. The group decided, quote, "We cannot support the American Health Care Act in its current form."
Dr. Stephen Corwin is the president and CEO of New York Presbyterian, also a member of the American Hospital Association. New York Presbyterian, by the way, is one of the nation's biggest healthcare providers. It is sixth place on U.S. News and World Report's best hospital list, so they're doing something right over there. New York Presbyterian serves more than 4 million patients every year, and Dr. Corwin joins us at the table. Thank you so much for staying.
Thanks for having me. Thanks.
We're very glad that you're here. So your group said cannot support it in its current form. What concerns you most?
Well, I think that the Medicaid expansion and rolling back the Medicaid expansion as of 2020 is going to create a real problem.
How much of your work patients receive
30% of
Medicaid?
our patients are Medicaid.
Wow.
And that, you know, remember, 1 out of every 3 New York City residents is on Medicaid. And you've got a lot of people on Medicaid in Republican states as well. So this is a big deal. $800 billion is going to come out of the Medicaid program over the next 10 years, and that contributes to that deficit reduction that you talked about, Gayle. And that's a big issue, because a lot of people are not going to be insured.
And the budget office says now 24 more million people will not be insured. How does that affect your hospital specifically?
Look, I think that we're about taking care of patients, and I think that we have to, as a country, decide, is health care a right or is it a privilege? If it's a right, then we've got to insure everybody. And if we want to ultimately control the cost of health care, you've got to insure people.
So therefore, what is the fundamental misassumption on the part of this bill?
The fundamental misassumption is that you need to subsidize people more, and you need to keep the individual mandate. Otherwise, you cannot have a functioning insurance market. Point number one. Point number two is...
You've got to have a mandate that forces people to have insurance.
Absolutely.
Just like car insurance.
Car insurance, property insurance. You need young, healthy people who are paying premiums in to offset the costs of other people who are sick.
So they abolish that. So what is the other assumption that's wrong?
You got to take care of poor people. In the states that didn't expand Medicaid, you have to earn less than $6,000 a year to qualify for Medicaid for a family of 3. Now, as a country, I think we've got to come to grips with that. I believe in a public-private partnership. You have to have commercial insurance and you have to have Medicare and Medicaid. Let's come together and figure out how to do this. This bill absolutely does not do this.
But the power behind reforming and repealing the Affordable Care Act, the conservative movement, is that this was a mandate, a burden on small and medium-sized businesses to pay for health care. The question still remains, who's going to pay for it? Are taxpayers going to pay for it and higher taxes, or are businesses going to pay for it? What's the answer there, and is there any fix in this bill?
Look, Norah, you're absolutely right. The cost of health care in this country is too high. Doctors, physicians, everybody has to really focus on getting the cost down. But having said that, you got to insure people. And I think that by not insuring people, the cost of health care is going to continue to go up.
The AMA, the AHA, the doctors, hospitals, all backed the Affordable Care Act, Obamacare, and under the promise that premiums would start to slow down. Premiums have skyrocketed.
Premiums have skyrocketed.
What happened?
A couple of things happened. First, you have lack of competition in certain markets. Secondly, you didn't have enough young, healthy people sign up.
That's the point, too, isn't it?
Yeah.
You got to have young people have to be buying insurance. If they're not going to be a system to take care of older people.
But Norah, let me flip it around to you for a second. What's going to happen with less subsidies? And what the CBO has said is premiums are going to go up in the short run. The only reason premiums go down over the long run is older, sicker patients will opt out of the program because they cannot afford it.
Yeah. There has to be a fundamental shift. People don't want to pay for health care. They don't want to pay. People will pay for all kinds of things, a car, they'll pay for
house insurance.
House insurance. Because in the past, the system was always that your employer, if you had a good employer, provided your health care plan.
Well, employer-based health insurance is the bulwark of the system. 170 million people get that. So what we were talking about was Medicare and Medicaid. That's another 150 million people. And then what do you do in the individual insurance market?
And how many are in that market?
Right now, it's less than the CBO projected. That's part of what the Republicans are claiming about the CBO report. But part of that is because people didn't really insist on the individual mandate. There was the Supreme Court challenge on it, et cetera.
I got to say this, guys. I went to New York Hospital for my surgery, and Dr. Girardi and Lerman and Blumenthal took really good care of me.
Well,
I know.
I appreciate that.
Therefore, I feel lucky.
Well, we appreciate the compliment. It's you're a terrific show. I've got to tell you that my wife watches you every day, so she's a big fan.
Well, your wife has excellent taste, may we say, in morning shows and in husbands.
Yeah.
Thank you
Thanks.
very much.
Thank you for taking such good care of Charlie.
Yes, yes.
Yeah.
Well, they're
And
not
really-
6 on the list for nothing.
Yeah,
over
and
at that
really smart
hospital.
discussion. I think we should do more of this. We have been on our issues that matter. It's
Happy
really
to.
Confusing
Yeah,
for a
happy
lot of
to.
people.
Yeah, it's really
Helpful to have
interesting.
you here today.
Turns out it's complicated.
Yes. Very complicated.
Who knew?
Thank you.